So, Ramani, I was about to ask you this. If there is no cure, what are the risks? How can we reduce the risk?
Or some steps towards prevention. Of course, there's no 100% guaranteed immunity here, but then you can definitely age healthy with good brain health. So, what can you do? There are 14 risk factors that Lancet has put out, right? It has got education first in early life, education. If you have more education, you naturally have more protection towards dementia. So now education is something you cannot correct at present if you're in your middle life. But then as government, there is a policy level thing that you need to do, that every child gets education, because brain health is not something you can develop at 30s and 40s. It is a lifetime thing. From early life we should have good brain health. So start with education in early life. That is your first and foremost thing. More educated you are, you're more protected. So that needs to be
Ramani, sorry to interrupt, but when you speak about education, most of us finish off our education in our 20s, maybe 25 by the time if you choose to do a post graduation, then most of us get into, working and all of that. Now, if you are someone who continues to like keep yourself updated, continues to go and study in a way, does that also help?
Absolutely. See, what are you doing? You're forming new neuronal connection. You're going on forming new neuronal connection. Of course, you're working anti what dementia is doing, right? It is killing your neuronal connection. You're doing more. You're building your more neuronal connection. So, of course, it is very, very helpful. In fact, that is again one of the risk factors that have been put in the Lancet study, right? If you come to the middle age, see, middle age, when you say it can span anywhere between, say, you take 20s to your 45, so you have a large window to really work on your brain health. So what all we should do? We are talking about midlife obesity. See, in India, obesity is a huge problem. Midlife obesity is definitely a huge problem. Many of us, due to COVID, working from home has really destroyed many of our lifestyle, right? So midlife obesity is a huge problem. So if you are able to work on your midlife obesity, it is going to be protective to your brain, not just your brain, but your heart will also tell you thank you. So, midlife obesity is one. Physical activity is another. Go get your 120 minutes a week. Get it. That's all what somebody is asking for. 30 minutes, 4 days a week is all you need to keep yourself going, your heart and your brain to be in good health. So, get your physical activity. Number three, sugars. See, sometimes in many research paper, Alzheimer's is also called the diabetes of the brain. Okay, so diabetes has a very, very close connection to your brain health. So it is important that we ensure that we look after the diabetes. If managed well, if treated well, that risk you're able to reduce. Then we talk about hypertension, because when you get diabetes, what happens after certain years? Hypertension becomes inevitable. It comes. So look after your hypertension. Number five, look after your cholesterol levels. LDL cholesterol in India is also added as one of the risk factors. You need to look after the LDL cholesterol level. Next, head injury. In India, so many people get head injury just because we don't wear helmet when we are driving, when we are riding, and the pillion thinks that you have to wear helmet because police will catch you. No, you have to wear helmet so that you protect your head. That's what you need to understand. It's not about really getting caught by somebody. It is important to protect your head. So you need to do everything to ensure that you don't injure yourself. So head injury is another thing that you need to look at. Next is all the wrong habits, smoking, alcohol, both of it, tobacco. Smoking, alcohol, and tobacco are bad for your overall health. It is even more bad for your brain. So it is important that we stay away from those. Alcohol, definitely in moderation. Smoking and tobacco, it's a big no. So that we need to be careful about. Then depression is another thing that's a huge risk factor. See, loneliness is an epidemic. WHO says loneliness is an epidemic in the world. India is a country with billion of people, but you could be still lonely among people. We think being around people is addressing loneliness. No, it is not. Loneliness is about where you are not able to share what you're going through, even though if you're among your friends. So that's not how it works. You need to have circle of people with whom you're able to share. You're able to sort of, have your happiness, sadness in a group. You have a confidant in your life. So that's very important. So loneliness is again a risk factor. Depression. See, these are all treatable. So depression again is one of the risk factors for dementia. Depression in younger adults is still we are able to pick up, but in elderly, it really doesn't come off. So it is important that you get screened for that. Hearing and visual impairment, again, easily correctable. These are also risk factors for dementia. And then, of course, another one that we really cannot do anything about it is pollution. So pollution, air pollution, again, is one of the risk factors for dementia. So we should see that even though we cannot do much to the air pollution bit, but if you are going to polluted places, try to see if you could wear a mask. One of the highest risk factor for dementia is age. You cannot do anything about it. So one, age is a non-modifiable risk factor, but here you have 14 risk factors where you can act, you can do something. If you do something, your risk of getting dementia can come down as low as 45%. So it is important that we work on those risk factors.
And like you also pointed out earlier, Ramani, you said that early on in the answer. It is not just dementia. By doing all of this, we are actually reducing the risk for a number of diseases, including
Absolutely.
diabetes, heart disease, stroke, etc. Right? So
Yeah.
it's in that sense, it's a force multiplier. If
Absolutely, absolutely. In fact, when Lancet released the 14 risk factor, I think we shouldn't call it the risk factors to dementia, but we should call it what are the ways that you can age well with good physical and brain health? Because this is not just about dementia. Whatever risk factors they have listed, it is something that also affects your physical health, social health, and cognitive health. It is a comprehensive risk factor listing that has been done. So don't do it for dementia's sake. Do it so that you age comprehensively well.
and of course, don't just test for your physical health, test for your cognitive health.
Absolutely.
Which
Absolutely.
you pointed out.